Okay, doctor, lots to talk about, including a procedure that you perform with a camera that's called hip arthroscopy. But we're going to talk about that in a few minutes because I want to get to a few questions. And our first one is from Florencia. This is a video question from her, and she's a tennis player. Let's take a look.
I just wanted to ask the doctors if there's a better way to treat muscular injuries from when we play tennis in the elbow or in the knees, and what can we do better if we want to get better faster? Any technique that we could do better with ice, with hot, with warm? What should we eat?
Wow, lots of great questions there from Florencia, doctor.
Yeah, good question, Florencia. I think that the earlier you start with the treatment, the faster you're gonna heal. You know, when we talk about a muscle injury, we sometimes call it as a muscle strain or a muscle pull. And what's happening, you have an injury to that muscle that disrupt the blood vessels and they start bleeding. And then you start having swelling and bleeding. So if you start controlling that bleeding and that swelling early, the earlier you're gonna get better. The way you can do that is with ice. You know, it's a common thing to do, just put ice. But the earlier you start with the ice therapy, that will help you. Also, that muscle, you wanna have it in complete stretch. So you wanna put it in a stretching situation and with ice therapy. And you know, the more easiest way to start this treatment is to follow the protocol of Price. You know, protection of that injury site, rest of that injury site, ice, that cold therapy that I was talking about, and creating some compression on the area, but just a gentle compression, not too much. And also elevate that injury so that swelling can come down. And once the swelling starts coming down, then you can start feeling better.
And doctor, I'm going to piggyback on that if you don't mind and ask you regarding the ice. A lot of people will say, well, is it ice or is it heat? Is it both? Can you chime in on that?
Great question, Olga, because it's a different ways of treating it. So when you have an inflammation and you have bleeding in the site, you want to diminish that bleeding. Ice do that. So the ice will decrease the blood flow to that area. So it will decrease the inflammation. It will decrease the blood bleeding in that area. The heat therapy, you have to wait until the inflammation comes down. So then you can start using heat, because actually heat open the vessels and it will bring more blood to the area. And that's, you don't want at the initial stage. You want that swelling to be controlled, and then you can start using heat. But I think to control swelling and pain and the initial injury, ice is the way to go.
Fantastic. And then one thing that she did mention that I want to also follow up on is technique. That's a great question because a lot of tennis players, you know, have to use their arms, dancers. So when it comes to technique, what can they do to help avoid those accidents from happening?
You're completely right. One of the things that you have to focus always is stretching before and after your activity. People that don't stretch actually are the ones that start getting injured. Also, in your sport, you have to make sure that your mechanics are optimized. So that's one of the things you have to train on, is to improve that mechanic. Make sure that whatever activity you're doing it in the optimal way of moving that joint. Because a lot of the injuries that we have is that we modify, we change a little bit the way we're moving that joint, and that can lead to injury. So I think I will focus well on prevention. And the way you can focus on that is just to optimize your biomechanics. Some of the players get videotaped and they analyze the way they're moving. That way you can see, hey, I'm doing this way, that way, and you can modify that in order to have an optimal biomechanics or mechanics of that joint to prevent injuries.
Great stuff. All right, doctor, we have another question, and this one is from Victoria, who is also very active in sports, and I love hearing that. Let's take a look.
Is there a way to limit the way our bones are being tear away?
Ooh, that's a good one, because that plays into genetics. Is it really your body? Is it what you're doing? Take it away, doctor.
That's a great question, I think, Victoria, because bone health is extremely important, you know, and you have to maintain that bone health since early in your life. You know, good nutrition, good activity level, that will keep your bones strong. And you want to keep that strong because, as Olga mentioned, there is multiple factors, either genetics or environmental or your own diet or your lack of activity, that will predispose you to have weak bones that can lead to injuries. Also, you have to focus not only on the bone, but in the joints, because the joint health is extremely important also. And that's when activity and muscle strain can protect those joints. But I think keeping a good diet and good activity that will keep you mobile, I think is essential to prevent injuries.
And Doctor, we could go on forever, but maybe a couple of ideas in terms of when you say diet, what do you mean? Do you mean healthy fish? Do you mean lots of milk? Lots of people say milk does the body good for the bones. Tell me a few ideas.
No, definitely. I think you have to have a good full diet that encounters everything. Milk is because of the calcium. You have to have a good calcium intake for your bones to be healthy. But not only that, you also need vitamin D. And a lot of people are down in vitamin D. So I will focus for bone health, good intake of vitamin D and calcium, because those two work together to maintain the bone health. And then having a regular diet, don't excess on fried stuff and bad stuff that we know are bad. They taste good, but they're not good for your health.
This is true. All right, doctor, just want to remind our viewers that if you have a question, just send them in. You can email us to questions@allhealthtv.com or give us a call at 855-796-4475. All right, doctor, we have a question from Gloria, who is recovering from hip procedure. Oh, let's hear what she has to say.
Okay.
Hello, doctor. I'm Gloria from Doral, Florida. And my question to you regarding surgery 5.5 months ago. Fell down the stairs and had to have an emergency posterior full hip replacement. And so now that I'm in the post-op and I'm going to physical therapy and I'm doing a lot of stretching, and I'm concerned about the kind of stretching I'm doing. I want to know, first of all, if I should be doing, what kind of stretching I should be doing, if I can do a lateral stretch of my hip and not, hurt myself. I've gotten mixed reviews on that. And then the second thing is if I can expect full flexibility back, because I would love to be able to put my shoes on, cross my legs without it hurting. Thank you.
Yeah.
Thank you, Gloria. Doctor?
Sorry to hear that, Gloria. You suffer a bad injury, but it looks like you're recovering pretty good. You look pretty good. So, hip replacements are great surgeries, but it's something that you have to protect over time. And, it takes a while for your muscle mass to get strong again. So I will, encourage you to continue doing your physical therapy, because the stronger you are, the better you're going to protect your joint, the better you're going to have function around your joint. And yeah, flexibility is extremely important. I will continue working with flexibility. Hamstring flexibility is extremely important, something that gets tight very quickly. So I will work on those and, do a combination of stretching and continue strengthening, because it takes some time to get the strength back. And I think it's 5 months out where you are right now. I think one thing that you have to improve is that strengthening and endurance. But flexibility is key, because flexibility is what you need for your muscles to work well. So I think I will encourage you to continue to work. I think a posterior approach, you have some limitations on stuff that you can do at the beginning of this after surgery, but at 5 months out, you should be pretty good and pretty safe to do a lot of the stuff.